Hi, everyone. Joining me today from Chicagoland is Jacob Persky, principal and co-founder of RHP Risk Management. Jacob, welcome to Healthy Air.
Hi, Eric. Thanks for having me.
So I want to provide our listeners with a brief background on Jacob to provide context for our conversation. Jacob Persky is an environmental consultant with 20 years of experience as an industrial hygienist. He considers himself to be an exposure scientist and specializes in helping clients to contextually understand and manage health risks from exposures to hazardous substances. Mr. Persky holds a Master of Public Health degree from Benedictine University and a BS degree in Bioengineering from the University of Illinois. He's a board-certified industrial hygienist. His work has taken him to many diverse work settings in the fields of pharma, R&D, semiconductor manufacturing, automotive manufacturing, railroading, healthcare, facilities management, and oil and gas, and at interesting locations throughout the US and abroad to Mexico, Australia, Brazil, and Bolivia. So great to have you on today, Jacob. To kick us off, tell us how you got your start in industrial hygiene and environmental consulting.
Sure. So when I was in high school, my father worked at a laboratory as an electron microscopist, and that laboratory had an industrial hygiene division. And when I was in college over summer break, it was comparatively very well paying to go out as an air sampling technician. And that was how I first worked in the field of industrial hygiene. And after graduating from college, that experience is what landed me my first job working for an environmental consulting firm.
Cool. So let's fast forward a little bit. So 2015, you founded RHP Risk Management. Mm-hmm. What motivated you to do that and go off on your own?
It was really an opportunity that presented itself. I moved around quite a bit early on in my career between different firms. And at that point in my career, I was working for a national consulting firm that was 1,000 persons large, and they were acquired by a global large consulting firm, an engineering firm, 16,000 persons large. And that larger firm really didn't practice in health sciences arena, or at least it wasn't a large focus. And it presented an opportunity to try something new, had very little to lose, and decided to co-found RHP Risk Management along with two partners.
Great. So give us an overview of the mission, focus, the scale, the scope of RHP's risk management business, and in particular, how is RHP differentiated from other environmental consulting firms?
Okay, so RHP is a niche consulting firm with 15 health scientists. We are headquartered in Chicago, but we do have a presence across the US with staff in Pennsylvania, Tennessee, California. And our mission focus is to provide exposure science and risk assessment solutions to advance public health. So what does that mean in common language? We help our clients to differentiate the concepts of hazard and risk so that they can make informed decisions and focus on the priorities that matter most.
Great. Okay, so let's build on that a little bit. Within your business, you have a state-of-the-art exposure sciences laboratory, and you and your team do both a lot of fundamental research as well as client work, measuring chemical, physical agents under recreated conditions. What types of exposures are you analyzing, and what's been hot recently?
Yeah, these are the fun projects. I really enjoy the work that we do at our exposure sciences laboratory. And we've looked at exposures from products that are currently sold on the market today, looking at things like titanium dioxide and over-the-counter sunscreens and how that relates back to a new FDA monograph that was recently released to regulate over-the-counter sunscreens. Looked at cosmetics, face powders, eyeshadows, and inhalation exposures when using those cosmetic products. Looked at isocyanates and polyurethane caulks and methylene chloride in paint strippers. So a lot of products and chemical exposure potential associated with those products. And we've also done work to look at historical work activities, like work with asbestos or solvents that relate to benzene or toluene exposures. And then lastly, we do work that is more along the lines of building ventilation and indoor air quality assessments, looking at engineering performance validations of equipment and developing a basis for performance statements by those device manufacturers, looking at how quickly they clean the air, conducting tracer gas studies, evaluating equipment that performs by filtration mechanisms or ionization, and also looking at personal protective equipment. One of the new things that has come out of this pandemic is the widespread use of face coverings that are not respirators. And there's been a long-standing approach to evaluating the goodness of fit for a respirator, but that corollary doesn't exist for breathable cloth face coverings. And ASTM recently came out with a new standard to perform that type of quantitative fit check on breathable face coverings. And we're gearing up to do some work to help mass manufacturers assess how their breathable face coverings perform with respect to that standard. So kind of a diverse set of exposure sciences work that we do out of our laboratory.
Great. Okay, so we're going to dig into the indoor air quality and safety piece of what you just described, and which is the focus of our podcast. So today, are you confident that we accurately understand the nature of the airborne pathogen transmission risk, COVID-19, but also other airborne pathogens like the influenza and otherwise? And then follow-up question to that, do we understand the risk correctly? And then do we have appropriate methods for assessing and analyzing this risk, controlling and mitigating this risk, and then verifying the efficacy of our mitigations and controls in real world spaces?
There's a lot there. I'll start with saying that I do believe we have a good understanding of the pathogen vectors and the control mechanisms for reducing exposure potential. These are principles of infection control that have been practiced in hospitals for many, many years. The challenge from the COVID-19 pandemic is really, well, first of all, it was understanding the aerosol transmission properties of SARS-CoV-2 specifically, but then the challenge became accepting the implications of those findings. And there are certainly some political overtones to that discussion as well. But applying the control mechanisms that we know work in a tightly controlled environment like a hospital isolation ward, and applying those in a meaningful manner in the real world in non-critical healthcare type settings, that was the challenge and continues to be the challenge. It's very costly to implement a lot of these proven effective controls in a real world setting. Administrative controls are often seen as easier to implement, like quarantine and shutdown, but there's an economic cost associated with each of those as well. They're not sustainable in the long term. And I do believe that there is a need to find long-term solutions that do work, that meaningfully reduce the risk, and they need to be proven effective and validated in real-world settings.
Yep. All right, so we're now going to get to kind of practical considerations with various people operating within the built environment broadly. So I'm going to ask you a series of questions, and we want to get your practical guidance on that. So in order to ensure high standards of indoor air quality and safety, and in turn, occupational health and safety, what should you be doing right now if you are a commercial building owner or owner-occupier?
First and foremost, I would say familiarize yourself with the industry-specific guidance that is out there. There's a tremendous resource at the website backtowworksafely.org that provides free guidance documents that are industry-specific, and there is one for commercial buildings that has been developed by health and safety professionals. So familiarize yourself with those guidance documents. And then as a building operator, I would encourage looking at proven technologies And if you're going to consider emerging technologies, you know, carefully consider those and make sure that they truly do create a safer environment. So
Hmm.
you know, select an approach and then test and validate that that approach is truly making a meaningful difference. Whether you're
Hmm.
selecting a proven technology or an emerging technology, I think it's really important to test and validate, develop data that demonstrates why your building is now safer, and then use that to market the benefit to your existing and prospective tenants. You know,
Hmm.
don't just use it as an improvement that is a program that goes and sits on the shelf, but use it as a market differentiator to really sell your building and use it as a marketing tool for your building.
Hmm. So now moving on. So if you are a healthcare facility owner occupier, which is, you know, a unique class of buildings, and that includes hospitals, clinics, and then nursing homes, which have been some of the hardest hit areas by the pandemic in terms of some of the health consequences, given the vulnerability of those populations. So what should you be doing now if you are responsible for running healthcare facilities, you know, from a safety standpoint?
Same thing. So start with the industry specific guidance, which it exists for healthcare industries generally and specifically for long-term care nursing home environments. So evaluate your building to identify the areas of concern and then decide to do something about it. There's a large amount of government dollars that have been allocated for use in healthcare facilities underneath the CARES Act. The Provider Relief Fund has allocated $178 billion that must be used by June 30th. One of the allowable uses of those dollars is infection control and building ventilation system improvements.
Hmm. Okay, so now going to the other side of the equation, if you are a tenant or an employee within a building, and so you're not responsible for building safety per se, but you are now, some cases, being asked to come back to work or back to an office location, what should you be doing to ensure your own safety, and what types of questions and measures should you be asking and taking?
Ask questions about what your building owner is doing differently or what are they planning to do differently. I think that there's a heightened social awareness and changed perceptions about the importance of healthy indoor air because of the pandemic. And many buildings, even prior to the pandemic, have very poor indoor air quality. Many buildings are operating with old, antiquated ventilation systems. Even modern buildings, a lot of times the focus was on energy conservation, sometimes at the expense of good IAQ. So during the pandemic, the pendulum has definitely swung back the other way, where there's a returned focus on the benefit to public health, even if there is a temporary increased cost associated with that. But I think as we emerge from the pandemic, there's going to be a tendency to try and swing the pendulum back the other way. And we need to use this as a catalyst event to try and strike a more appropriate balance between protecting the health of people in the indoor environment and energy savings.
And just maybe a quick follow-up on the tenant employee thing. So if you have a concern, you know, you're about safety, whether you're in the preparation to come back or you're back in a workplace or an office and you have safety concerns, what's the right way to kind of go about expressing those, or like what should people be on the lookout for, and what should they do if they have a concern?
Well, look for something to be different, whether that is the way the office is laid out, greater physical distancing and people density per square foot in the space. A lot of the companies that we're working with to help inform their return to work safely plans, we're looking at ventilation rates to spaces and the amount of clean air delivered per person or per square foot in a space, and using that as a way to inform occupant density in return to work settings. So I would say that In some buildings, the physical layout may look different. You may see that the equipment around the office providing air cleaning is different. There may be portable air cleaners, or the building may be undertaking a capital improvement project to upgrade the amount of air delivered into the space, or ability to filter that air at a higher rate, or bring in more clean outside air. So those are the types of things that you should be looking for as indicators that your office or your building is doing something differently responsive to the pandemic. And if you don't see those things, then I would start asking questions. Talk to your supervisor, or if you are in management, talk to the building owner operator.
Okay. So now moving into the various service professionals working within a building. So your own kind of line of work, environmental consulting. So in many cases, environmental consultants are providing critical safety and health guidance to clients preparing for return to work, or once employees or folks are back in a building, kind of continuing to advise during the process. What should an environmental consultant be doing these days as we're managing this situation?
It's important to recognize that there is no one size fits all approach, and we need to work to convince our clients that doing something different is truly in their best interest. One of the truths that I've come to believe in my 20 years of consulting is that people rarely spend money because it is a good idea. And you need to sell it by helping them understand the benefit to them. So working to quantify things like ROI, that's different now. So in the past, we may have justified a ventilation system upgrade by showing how moving to a more efficient ventilation unit could help lower their electric bills and the annual cost savings over the life of the device, right? And now we're looking at making recommendations to benefit the health and welfare of the building occupants, using methods that may lead to higher electric consumption. And we need to be able to still demonstrate a positive ROI on those recommendations. So we need to think differently, maybe framing the argument in terms of a reduced number of lost days of work and the cost to the employer from that lost productivity. And so it gets a little more squishy in how you calculate the ROI and justify these things. But I think intuitively, we know that improving indoor air quality is a positive thing to do. And we just need to kind of recalibrate how we go about framing that to prospective clients and justifying the need for that work.
So related but different kind of service line, the HVAC and MEP and engineering contractors who are working within buildings. Talk to us a little bit about what you think they should be on the lookout for, and especially, given, I'd say historically, not as much emphasis on safety, more of just the kind of, performance and operational and cost metrics of HVAC, with now this whole nother front of thinking about the systems. What should they be thinking about, and how should they be advising kind of clients?
First and foremost, push proven solutions. We know that ventilation works, whether it's filtration or dilution ventilation. And if there is a desire to explore the use of emerging technologies, then I believe it's really critical that the installation be validated and demonstrated that the stated health benefit is actually realized. If we don't do that, then there can be a false sense of security, which is even more dangerous, in addition to potentially wasted dollars. So
yeah,
really important to push the proven solutions. And if you're going to try the emerging technologies, testing and validating is critical.
Okay, now the last two categories, which are really professional risk managers. So the insurers in the insurance industry, what should they be doing right now, and in terms of thinking about the kind of world and the nature of the risk that we're confronting now with the pandemic and post-pandemic?
Insurance companies need to get creative. They need to find ways to differentiate their high-risk policyholders from their low-risk policyholders. The current trend right now with insurance coverage is is kind of a we don't want any of that type of liability approach, where they're issuing blanket exclusions on infectious disease coverage. And there's an ongoing battle between the primary insurers, who are highly regulated, and the reinsurance market, which is less regulated. And reinsurance market is stated that they will not provide reinsurance coverage for pandemic or infectious disease type coverage. And many of the primary insurers are trying their best to write that out of their policies, but some of them are being prohibited from doing so through regulatory efforts. So I think that there is a definite demand and a need for this type of coverage of infectious disease coverage. And it may be that under the conditions of epidemic or pandemic, that the risk is simply too great and it cannot be a covered event. But once we're on the backside of the global pandemic, there will be a continuing need to ensure these types of adverse events, whether it be through business interruption insurance, workers' comp, commercial general liability. And it's the insurance companies who are going to find new ways to parse out these risk levels that are really going to be the winners in this space.
Mm-hmm. Okay, and last but not least, legal compliance officers, whether they're kind of third parties advising clients or they're in-house, what should they be thinking about and doing right now?
I would say do something. Document your efforts and show that you did something to address the concern. A lot of the clients that we've been working with, these types of decisions are often pushed to the legal team or the HR team. And some of the conversations that we've had have taken an approach that is more along the lines of an ostrich with their head in the sand, and stating that they don't want to know what's in their blind spots out of fear of being held accountable for not doing enough, perhaps. And I think this is fundamentally the wrong approach. I think it is better to make an effort to understand what you're dealing with. And even if you have limited resources, make some sort of effort to improve the conditions. Claiming ignorance is not a valid reason. There's always the counter argument to that you should have known.
Okay, well, and let's pick up on the compliance thing. So, one kind of fundamental question is compliant to what? The federal and state regulatory guidelines and rules have been evolving rapidly over the past several months, with the evolving understanding of the COVID risk, and then a change in presidential administrations, a push for return to work and kind of stop-start with that, return to school, and it's really hard to keep track. And then you have the kind of changes at the federal, the state level, within states. So can you just, to your best ability, distill down where are we at right now with regulation as it relates to infection control, ventilation, compliance requirements? And then if you can specifically talk about the federal OSHA NEP, National Emphasis Program, and then the interim ERP, the Emergency Response Plan, where RHP is doing some specific work there. What is going on right now, and then what do you foresee coming on the horizon over, the balance of 2021?
Yeah, over this last year, the science has really evolved, and along with that, policy has evolved, but they haven't always moved in tandem. And certainly the regulation side of that has been slowest of all of them to move. There's been and still is a very limited amount of regulation that's come out of the pandemic, but there's an abundance of voluntary guidance. In January of 21, President Biden issued an executive order titled Executive Order on Protecting Worker Health and Safety. And that required OSHA to do two things. So the first thing that it compelled OSHA to do was to launch a national emphasis program. And the purpose of that was to compel OSHA to increase inspections on facilities that put the largest number of workers at serious risk for COVID-19. And so that national emphasis program is actively ongoing and has been since about March. The other thing that the executive order compelled OSHA to do was to determine whether an emergency temporary standard for COVID-19 was needed. And the executive order required OSHA to make that determination no later than March 15th. We are still waiting for that. It is June, and looking out at where that process stands, we understand that OSHA has developed some draft language for an emergency temporary standard, but it's not been published. They're asking for more time. And just a couple weeks ago, they delivered that draft language to the White House, and it is currently unknown when or if it will be released to the general public. Keeping my pulse on the industry, I've heard some speculation about what its contents may be, and there's a belief that it may address different requirements for different levels of exposure in different industries. So, for example, perhaps different standards for healthcare and correction facilities. And it's also expected that there may be some shared elements with the California OSHA emergency temporary standard that's been in place since last November. And I think one of the biggest things with the federal OSHA pending ETS is there's likely going to be a judicial challenge to that by the stakeholders. You know, the conditions that justified implementation of the emergency temporary standard, according to the statute, requires that there be a, quote, grave danger imminent. And the stakeholders are likely to argue that that grave danger period has passed with the reduction in incidence rates of disease and the rollout to the vaccine. So I think it will be, it's unknown if that emergency temporary standard will be published at all, and if so, when, but if and when, I think it's highly likely that it'll be challenged on a legal basis.
So I want to make a couple quick points and then, just follow up on one thing related to compliance. So on the regulatory side, one thing that has been rumored, and I don't know if this is still kind of in the cards, is that there could be a potential skip of the ETS and creating a permanent infection control related standard, which is, I believe, is unprecedented. Have you heard anything about that, or have you heard that same rumor, and do you think that is a possibility? I guess I'll just stop there on that question.
I have heard that, but I don't have any personal insight to the probability of that versus an ETS type approach. I've not been privileged to any of the discussions between the stakeholders and OSHA, and have not seen the draft language. So I don't know, but it would certainly seem to me to be a possibility.
Yeah. Okay. And then the next question is just, what you described is very dynamic, very complex, practically for people who are trying to be compliant, and just defining what that is. I mean, what do you advise? How are you staying on top of the evolving situation with all these regulations? And what do you think is, what would you advise others who are just trying to ensure that they are compliant?
Follow the voluntary best practice that is currently out there, whether it's from an authoritative agency like CDC or state health department, or voluntary guidance from a professional organization. Do something, document it. The worst thing you can do is to not do anything and claim that you didn't know better, because we clearly know that there's a need to do something with the pandemic.
Yeah. Okay. Well, switching gears. So I want to put you on the spot a bit regarding the industrial hygiene and public health community's performance during this incredible occupational safety and public health crisis that we've confronted with the pandemic. What would, and I guess there are two distinct communities. So there's industrial hygiene, there's public health, and the nature of the pandemic is spanning multiple different, communities. But what grade would you give kind of, and you're a member of both of these communities, public health and industrial hygiene. What grade would you give these professions overall in terms of their performance and specifically providing effective, timely safety guidance during the pandemic? And what have been the kind of bright spots where they have excelled, and where are there areas for improvement?
It's hard to give one grade to the entire public health practice, but I would say that public health is a very broad community, and certainly the frontline workers in healthcare, the doctors, the nurses, provided us with a tremendous response. So A plus to those frontline healthcare workers. Then in public health, there's also what I like to call the desktop scientists, the epidemiologists, biostatisticians, and they really stepped out into the limelight during the pandemic, helped us make sense of immense volumes of data that was pouring in, convey it to us in ways that was understandable to the general public, and also helped to develop messaging that reached the public and affected behavioral change. If the message was everybody stay at home, quarantine, and wear masks, I think there would be, rightfully so, a need to justify that through data, and that's where those desktop scientists really shined in the pandemic, I think. Perhaps elsewhere on the report card with a less than an A, you may find the policymakers, in my opinion. I think there are a lot of lessons learned out of the pandemic and the way that public health was quickly turned into policy. It seemed to me to be somewhat disjointed, especially looking across different states and different state health departments and how they structured their response. Here in Illinois, I personally feel that there was somewhat arbitrary goalposts that were erected around the guidance provided by the state health department. It was quantitative in nature, so that's good. But I believe that numbers need to have a basis, and I don't feel that those were ever effectively communicated to the public, and still remain a mystery to me in many regards. So I think that there's a room for future work to develop a common framework for risk-based policymaking.
Mm-hmm. Okay. Well, in looking forward to what risk-based policy making may look like, one idea that has been recently floated and seems to be gaining momentum is the idea of ventilation certificates for buildings, similar to food hygiene certificates that we have for restaurants. A number of top scientists co-authored a piece in the recent end of May edition of Science titled "A Paradigm Shift to Combat Indoor Respiratory Infection. Building Ventilation Systems Must Get Much Better." And they essentially highlight how vulnerable buildings are to pathogen transmission. And they draw a historical analogy to the fact that we're kind of in a big moment similar to where Britain was in the mid-19th century, of lots of water-based public health and safety risks, and then eventually that spurring kind of sewage and sanitation practices that we still kind of have in place today. We're at that similar point in terms of indoor air quality, building ventilation, and the ventilation system plays a critical role in mitigating this risk. And then they propose this idea of certificates. So basically we need better standards and ways of testing buildings to ensure public health and safety. What do you think of this idea? Does it have merits? And if so, how would you see something like this being implemented in the real world?
Yeah, I really liked that article that was published in Science a couple weeks ago. I know it got broad circulation on the news media, and I especially liked the way that it framed the message in the context of previous public health triumphs. So, and I agree with the general message, which is that there's a need to address indoor air quality for the protection and benefit of public health the same way that these triumphs of past generations addressed foodborne illness and water quality safety. So I think that that's a timely message, and clearly the pandemic is a catalyst for that type of messaging. So there's, I would say that it's generally a good idea, and it has implications that extend well beyond the COVID-19 pandemic as well. You know, just looking at, for example, the rates of influenza over the last flu season, and how those were drastically lower in comparison to previous years because of these preventative measures that we've implemented, you know, for purposes of COVID-19. So there's clearly a benefit to continuing these types of practices or placing these controls in place long term. How to do that? You know, that's tricky. As I said before, there's no one size fits all solution. You know, perhaps it's the development of performance-based standards.
Great. Okay, so looking forward also to the way that industrial hygiene and exposure science is kind of evolving and taking the pandemic experience and other challenges that we're confronting today. You know, where do you see technology and innovation being kind of exciting, and where there's real potential to integrate these tools into real world practice?
Yeah, trends for the future, I think, are going to focus on concepts like big data, microsensor technologies, genomics, personalized medicine. There's going to be a shift towards having an integrated approach to understanding exposures and how that translates to risk on a personal level. You know, looking at the historical practice of industrial hygiene and the use of occupational exposure limits, we know that those are not bright lines between safe and unsafe work conditions, and they're only protective of, you know, what OSHA would call nearly all workers. But it's not just the future, it's here now. We're in the age of genomics and personalized data and microsensors, and I think that is the future. It's really taking larger volumes of data and making it personable and actionable.
Mm-hmm. So how do you stay on top of the pulse of the market, you know, within industrial hygiene, exposure science, public health? What are you reading? Who are you speaking with? Whose opinion do you really respect and value?
I like to read journals and magazines, keep abreast with popular news. So some of the journals that I regularly read are the Journal of Occupational Environmental Hygiene. The Society for Risk Assessment puts out the journal Risk Analysis that I like to read because it takes a lot of the risk management principles that I apply in the paradigm of public health, but applies them in other contexts. And so it's interesting to see how risk management, risk analysis approaches are being used in other areas besides public health, and give some thought to, you know, if there are any novel ways that risk management in those other areas could be applied in my practice area. For news, I like to read Forbes, magazines, Scientific American, Synergist, and just staying networked with the professional organizations, you know, going to conferences and presenting and getting involved with volunteer groups and trade organizations. And you know, the conference attendance has certainly been a challenge over the last year and a half or so, but virtual attendance has mostly worked out, I think, and looking forward to getting out there and involved, seeing colleagues in person as well.
Okay, well, fantastic discussion. Before we go, we want to give you the floor to share any parting thoughts, wisdoms, anything whatsoever. The floor is yours.
I guess my parting thought would be that the world has really changed forever as a result of the pandemic. It's really been interesting and exciting to see the jargon of industrial hygiene go mainstream. You know, reading news media articles with terminology like PPE, aerosol, microns, respirable. You know, these are all of the things that were part of the industrial hygiene lexicon a year and a half ago. And if you were to use in a conversation with laypersons, they kind of give you a furrowed eyebrow and not know what you're talking about. But there's a widespread awareness of these concepts now, broadened awareness about the importance of healthy air. And I'm really excited to see how these changes in societal attitudes and perceptions are going to lead to some sort of lasting change.
Cool. Well, great parting thoughts. Thank you so much for your time, your perspective and candor, and we wish you all the best in your all the great work you're doing.
Thank you, Eric.